Hey guys, Alex with Seattle Dreambody Clinic here. I've been behind the scenes for the last few years, but now front and center doing a bunch of videos, so you should be seeing a lot more of me. Today I'm here with my friend Terry. I've known Terry for many years. He works at the club I used to work at, and well, Terry, why don't you tell him a little bit about yourself, and we'll go ahead and tell you guys about his little adventure down to Mexico.
Sure. So I've been lifting like most of my life, at least my adult life, and injuries came and went periodically. Had a shoulder injury that popped up about 3.5 years ago, and I've had shoulder injuries before, and they come and they go, but they never last that long. This one would not go away, and I thought maybe it was because I'm a little older, still gave it some more time, tried to back off a little bit. Tried physical therapy, tried massage, did an MRI, and basically the thing still hung around with pain. So then I ran into Alex and I were talking, and he said, hey, have I got a deal for you?
So basically, Terry and I was chatting in the gym, and he was probably benching that day. I think it would have been.
Probably, yeah.
It was mentioned numerous times that his shoulder was giving him some trouble, and I was like, well, we're doing some pretty amazing treatments here where we're doing some stem cells straight into the joint and actually healing the joint, a lot of times preventing people from having to get surgery, and we actually basically give the body the tools it needs to heal itself. So keeping you off the operating table and keeping you in the gym really was the main two pitch points that I gave him. And Terry, why don't you just got back, right?
Yeah, a week and a half ago.
All right, why don't you want to give us an idea of how the trip went for you from
Sure.
leaving Seattle here?
Well, so this is Seattle, and in December, which rainy, cold, and one of the reasons I thought about doing it was, okay, let's see, I can go down there, and if it works, this is great, my shoulder's going to be great, and if not, I spend a little bit more money on vacation, going to Mexico, 84 degrees every day, which it was, so couldn't beat that. So headed down there midweek, and the clinic had someone pick me up at the airport. My wife went along with me, took us to the hotel, and the next morning they needed to do blood work, so they came and got me from my hotel and took me to the clinic to do the blood work, brought me back to the hotel, and then the treatment's the following day. So again, they came and got me, and we went in, and they draw some more blood to mix with the stem cells and all the magic that they do.
Yeah, and Terry, did you ever feel like you were in danger in Mexico?
Oh, no. Actually, so my wife went along, and she was just scared to death. She didn't want me to go alone. She heard all the horror stories of going to Mexico and how bad it was. And she came back going, wow, I can't believe how that was. Great place to hang out, inexpensive food, nice people. They love you down there.
Oh, they're so nice.
Oh, inexpensive massage. I mean, I recommend to do the massage down there. I got a bunch of places down there for very inexpensive. We did couples massage every day. So, yeah, it was absolutely great.
And this is in Puerto Vallarta. We're in the San Javier Hospital right there in Nuevo Vallarta. Doing a lot of cool stuff around that area. Building a big theme park and a lot of investors there. It's a beautiful area. I've never had any hesitation, especially with Puerto Vallarta. People have always been welcoming, and it's a great place to take a trip.
Well, and so while we were there, the owner of the clinic, Josh, was talking to us, and we ended up being the last patient of the day. So I was doing the IV part, which takes an hour for that part. And so while we're doing that, he was telling us about the research that he'd done, about some results that they've had, and a lot of things and the benefits of it. And my wife was sitting there with me, and very skeptical in general. We had to talk about it before I finally went down. She didn't want me to go alone. Well, unfortunately, we were near the end of the time when we were going to go home, because she said, so if I want to do it, how much time do I need? Well, there wasn't enough time, or she would have signed up and done it on the spot. I'm hopeful this one does, and if so, they're going to have to charter a plane, because there's a lot of people kind of asking me, hey, if it works for you, I'm heading down there. So could be a lot of people.
Yeah, so that's why we do these videos, is because we want you to be able to relate to the person who is having the procedure done. And I'm here in Seattle. I'm going to be talking with people in the area. If you would like to reach out to me, my number is down in the info section below here. I am taking phone calls. I will put on a seminar at some point, but that'll allow you to get a good face-to-face and prior to going to Mexico, prior to committing. I know that was probably a big thing for you, is being able to talk to me, and someone who's known for years. I have quite a bit of knowledge in the area, and I know how we operate. And shoot, I've known Josh for over 10 years, and we've been working together for, I think, almost 4 now. So we go back and have a bit of, it's nice to talk with somebody face to face, rather than kind of making that leap. And so if you're kind of almost getting peace of mind and information and, putting a face in front of you and a body in front of you before you taking a flight to Mexico. Overall, it sounds like you had a pretty pleasant experience. I mean, chauffeur to and from, the weather was great. As you heard, the procedure is pretty simple. I wanted to talk about each one a little bit. So we recommend the joint because it was shoulder issues, and like I said, it's an MRI and some stuff. And nothing necessarily requiring surgery in there, but there is definitely some trauma to the different connective tissues and the shoulder itself. He has some pain. So what these stem cells do is they increase the ability of the body to deliver nutrients to these areas, and also the ability for the body to heal itself. Almost directing traffic. Think of almost like a job site, like a foreman on a job site. You got a bunch of people standing around. There's a whole lot you can do, but they're not going to do anything until that foreman is on site telling them what to do, right? And so when these stem cells come in there, they're another name for messenger signal cells. They basically come in and direct traffic and tell your body what to do and allow it to do what it's capable of, but it's not going to do on its own.
So Alex, I have a question. So I did it a week and a half ago, maybe some inflammation's down. How long before I should really be able to start seeing the real benefits of this?
What I'd say is probably about a month or so. You probably feel a bit already because we've increased the fluid in the joint, and so a lot of times this gives a little bit of relief. But the stem cells are in there working away for about a month. And so usually after about, I like to check in about 4 to 6 weeks post. And it'll continue to heal, especially since we give you the implant as well. So it's going to be slowly releasing for upwards of 6 months. And then the others are basically just like a super shot, right? So we got 100 million in the joint, or no, 44 million in the joint and 100 million intravenously. So the ones in the joint should be going right away. I mean, it's been about 10 days or so. Mm-hmm. So those should be helping already. I would imagine that your shoulder feels a bit better.
Well, actually, when I lifted like 10 days after, I was a little surprised. There was less pain in that shoulder than there had been in quite some time. Jury's still out, but it seems to be, could be that.
So obviously listening to your body, and it's part of a full treatment. We don't just throw some stem cells in you and say, hey, take off, see you later. We recommend you work with a physical therapist and or a personal trainer and have somebody kind of monitor and make sure that you're rehabbing the joint or whatever it is that we're working on. In this case, his shoulder. I'll be helping him out with his shoulder, and we have some great PTs around as well that are going to be assisting with that. But it's kind of it's not a magic pill. I mean, it does some pretty amazing things, but you need to have a full package, right? And I guess let's touch quickly on, before this video gets too long here, let's talk a little bit about the IV. So he did the IV and the implant. The implant's basically just a slow release of the other stem cells. So about half and half of the implant and half of this is the direct IV. And you said it took about an hour. Yeah, the IV takes an hour. The shoulder injection, 2-3 minutes. Oh yeah. But the IV basically targets inflammation, and it works really well for autoimmune disorders, diabetes, and stuff like that. We've got blood sugars dropping right away. But what we've noticed, Terry doesn't have any autoimmune disorders or anything like that. But it's still going to target. It'll target his shoulder probably. It'll target his arthritis that he's got in the hands. That'll probably be where I'll notice it the most because they are basically targeting inflammation. So in the case of somebody with diabetes, maybe the pancreas, or depending on where it is. The unfortunate thing with that is we can't tell them where to go. It's good and bad. But that's why we recommended that Terry do both his shoulder and the IV, because if he just did the IV, it would help with his shoulder. I'm sure he would probably notice a little bit of a difference, but really nothing like you would see with both the injection, or both the joint injection and the IV. And so I'm looking forward to seeing your results, and we want to put real people in front of you that you can relate to. And Terry's perfect because he likes to talk about things that are good, right?
Yep.
And if it's bad, I'll talk about it too.
Yep.
And he's going to tell the truth. In 6 weeks or so, we'll revisit this and see how you're doing. Thanks for tuning in, guys.